Hello everyone, welcome back to my YouTube channel and welcome back to a video where I'm going to be talking about what it's really like to see patients with suspected coronavirus in an A&E or hospital setting. It's a topic that's been talked about a lot in the media and social media over the last few months. The first cases of coronavirus were suspected back in December, and we know that that has now spread to having cases of coronavirus confirmed, around the world really, in Europe, America, Asia, in a lot of places. Really, we're seeing continued spread. There's a lot of focus on Italy at the moment, and Northern Italy in particular with regards to the virus and confirmed cases there. So I thought I'd do a video talking about what it's really like to see patients with a suspected coronavirus, what the process is like, and hopefully alleviate some of the concerns and fears that the general population have. So my background is that I'm an A&E doctor. I work in a central London hospital, and like any other hospitals around the UK, we are seeing cases of suspected or query coronavirus. So coronavirus or COVID-19 was first discovered in the Wuhan region of China. It's believed to give primarily acute respiratory symptoms, but also widespread multi-organ problems in a certain number of cases. So the main symptoms we're really talking about is coughs, shortness of breath, fever, and sometimes headaches in patients as well. So I thought I'd start this actually talking about how we decide who's at risk of having coronavirus, because that's a big worry of people. How do I know if I've got coronavirus? And that's completely understandable. So I'm going to explain how we kind of stratify that risk and how we decide who we suspect and who we don't. There's two main things. Number one is clinical status, clinical symptoms. So we're looking for signs or symptoms of acute respiratory illness. So the main symptoms we're talking about there is cough or shortness of breath and fever as well, and or fever. Those are the main clinical kind of aspects to that. There are other symptoms that make us more suspicious as well, of course. The other aspect is epidemiological, so where you've been really, where you've travelled, and what we're interested about is whether someone has been to an area that is confirmed as being high risk of having the virus. So for example, if you've been to the Wuhan region of China. The other part of that actually is whether you've been in contact with someone who's been confirmed to have coronavirus. And that's an important point, not whether it's someone that you think that has been to a certain area, etc. It's about whether you've actually been in contact with someone who's confirmed to have coronavirus. And that's why actually we trace patients. If someone is confirmed to have coronavirus, we know where they've been, where they've travelled, and who they've been in contact with, because then we can trace those contacts and test them as well. So that's the first point really. Now, if you are sat at home and you're concerned about having coronavirus, we ask you to call the 111 service in the UK. There will be another service or similar services elsewhere around the world as well. So you make that phone call, you call up the service and be asked a lot of questions. So they want to know where you've been, your symptoms, your travel, etc. to find out more information. And if it is a concern that you meet the criteria of someone who could have coronavirus, we then decide what we're going to do with you. So that decision is made about whether you're well or unwell. So if you're well and you're in the community, you've self-isolated, so you're at home, you've taken all the precautions of remaining in isolation from 14 days of being back in the country. We then send out a community team who take swabs to test for coronavirus. That's how we're testing, we're using swabs. Nasal and throat swabs. Some places now are only doing one swab because the test is accurate enough. So essentially you can be tested in your own home, and then it's a matter of waiting for the test results to come back, and also or your time elapsing of 14 days being back here in the country, or being out of the risk of having or catching the coronavirus. If you call the service and you're genuinely unwell, so you're a patient who's actually quite sick and we're concerned that you have coronavirus, what we do then is decide whether we need to see you in a hospital setting or in a patient care setting. So there's a phone actually that we carry in my hospital. There's a phone that I'd carry if I was on coronavirus duty. And actually we get a phone call from 111 service saying, we have a patient who I think might need to be reviewed by a doctor. I then make a phone call to the patient and speak with the patient themselves and take a history, find out where they've been, how they're doing, whether I need to see them. So if I'm concerned that I need to see the patient, I'm worried about the patient, I will send an ambulance to collect the patient. So the paramedics will go and collect the patient from their own home, wearing all the protective gear, and bring the patient to a pod outside the hospital. So you might have heard in the news about the coronavirus pods. So essentially, to give you an idea of what this is like, they are almost like a little shed outside. Not really a shed, it's actually a clinical environment, but it feels like an outside building really. An outside building, usually a window, a door, funnily enough. And inside, usually there might be 1 or 2 chairs, some observation equipment, so blood pressure monitoring, etc., and a phone. So when the patient is in there and they first arrive to the pod, they can call us within the hospital on the coronavirus phone and let us know that they need to be assessed or have any conversation with them that we need to have. So the reason the pods are there is to keep the patient away from the general populace within the hospital, because the last thing we want to do is potentially spread coronavirus to other patients who might be unwell for other reasons. Once the patient has arrived safely in their pod, we'll have a telephone conversation with the patient, and I will go in and assess the patient. What happens next is that I will gown up fully in our protective equipment. I'm talking the visors, I'm talking the headgear, the masks, fitted masks, full gown, double glove, everything. We go in twos, so typically myself and a nurse, with a third person who waits outside the pod to assist and communicate with. So it takes quite a while to get ready. As you can imagine, we need to have proper hand hygiene before doing that, wash our hands properly, prepare ourselves. We actually need to get tested with a mask to make sure they fit properly. So what we do is we do a fit test. So I try one of the masks on that I think will work and fit myself, make sure it's sealed nicely, wear the mask, and then we put like a head kind of box thing on, that there's a scent that's sprayed into there, and if you can taste that, it means that clearly the mask isn't effective, and therefore we try a different mask until we find one that does work, and therefore we know that the protective mask is doing its job. So essentially what I'm trying to say is that we do a lot of different things to make sure we keep safe and that we don't catch the virus and pass it on to other people. Now, once we've done that and someone is fully prepared and ready and knows what they're doing in terms of protective equipment, they're ready to see a patient. So then once I'm ready, myself and the nurse are gowned up properly, we're ready to see the patient, we go into the pod. So when we go into the pod, we first ask the patient to wear one of the protective masks. The reason we do that is that these masks are quite good at, if you have the coronavirus, passed on by droplet infection, if you're wearing a mask, it's less likely you're going to give it to another person. So that's why we ask them to wear a mask. We take a full history from the patient, I examine the patient, and take observations, see how the patient's doing, and then we take a nasal and throat swab. We're actually moving now to using only one swab. Essentially we're swabbing for the virus. If the decision is then, right, the patient's actually quite well, they're able to go home, they can stay and self-isolate for that period of time safely, then that's what we do. We discharge the patient, they're then taken via the ambulance, the same procedure as before, back home to continue the time there until we either have a result that's negative, either they don't have the coronavirus, or that their 14 days elapsed. If the patient has coronavirus, they'll be called directly and there's a clear protocol of what we do after that. But I'm not going to go into that in this video. So if the patient is actually tested at that point, and I've seen the patient, I think, oh, actually, I'm not sure that they're actually well enough to go home, either because I think they're quite unwell with coronavirus, or suspected coronavirus, or because I think they're unwell for another reason, and they need to come into the hospital, then we'll admit the patient. If a patient is admitted with suspected coronavirus, they need to go into an isolation room. So an isolation room has double doors, has negative pressure. And what that means is that essentially we're pulling air out of the room, into vents within the room that's cleansed and dealt with in an ethos or ether. So a negative pressure room, double doors, isolated, and we have strict protocol about who goes into that room, and also following the procedure of gowning, protective equipment, washing, hygiene, etc. So that's kind of an idea of what we decide. So either patients are tested in the community and are seen by a professional in the community, or they are seen in pods outside the hospital, or in rare cases the patient's brought in to hospital admitted. It's very unusual that a patient will be admitted. The mortality rate with the coronavirus is around 2%, something around 8 to 10% from figures I've looked at, patients are actually unwell or particularly unwell with the virus. The rest of those have actually had mild to moderate symptoms. Now, this is not someone that I'm not a virologist. I'm not someone who's an expert in infectious disease. I'm just looking at the sources are out there from WHO, the CDC in America, good sources of information that are clearly saying, from the data we have, that for the vast majority of people, their symptoms will be mild to moderate, with some being unwell with condition. So the next question I guess people ask me is, are you worried? Are you afraid, of seeing patients? Not really, because our protocol is very clear. We know what we're doing, we're very careful with protective gear, and also we know from the evidence that's out there, that the vast majority of patients aren't going to be that unwell. So no, I'm not afraid to see patients with coronavirus. I know, I've followed the protocol that I need to follow in doing so, and I'm confident in that. I think it's very important that the community, and as a country and as a nation, as a world actually, that we are alert and not anxious. I see people stockpiling medications, which is really, really bad, because essentially you're stopping potentially other patients having access to medications they need right now, stockpiling it for reasons that really don't make sense in many ways. It's really important to make sure people have access to what they need at that time. Trust in the government, trust in the healthcare system that we're going to do the right kind of thing. I also see a lot of people being really worried about travel. What I would say is check your travel advice in the country you're in. Check where you're going to go and follow that advice. If it's safe to travel, then travel. I myself are going away in a few weeks, and I will be checking, continue to check the travel advice for that area. If the advice is don't go, I won't go. If the advice is to go, I'm going to go. The most important thing you can do to protect yourself against coronavirus is hand hygiene. It sounds so daft, but washing your hands. Most people do not wash their hands enough on the appropriate times. I did a TikTok video on this. If you go to TikTok, @DrAlexGeorge, I cover this on there, so take a look. I'll also do a separate YouTube video on these topics as well. Also, I'm going to cover more information on my Instagram TV, @DrAlexGeorge, check it out. Thank you everyone for listening to this video. I hope I've given you an insight as to what it's actually like to see a patient with suspected coronavirus. There'll be more videos like this coming. I'm going to be doing a lot more health topics on the channel. I'm going to be talking about coronavirus more as well. Comment below and let me know what topics you'd like to cover as relates to coronavirus or other health issues, so that I can cover them in videos after this. Thanks everyone so much. Subscribe to the channel, like, comment, share, let people know about it. Have a good day. Take care.